I can see Eleanor, our speaker. Welcome on board. I can see Radha, Frederick, Stephen, Akech. Yeah, Judith, Daniel, Risi, Doris. Thank you so much for keeping time and for checking in already. We'll give it one more minute and see who else joins as we start. Thank you so much. Okay, we are at 11 of us. It's 6 o'clock according to me. Let's keep it, let's see if we can get to 20 when we start. I hope that's okay with everyone. Yeah. And thank you for your patience. This session. Thank you. Sorry for confusing you, David. So ADA Africa welcomes you to tonight's webinar. The topic is the role of systematic reviews in evidence-informed decision-making. And our guest speaker is Eleanor Ochodo. And my name is Marion Keinama. I'll be your facilitator for this evening. Now, just a few housekeeping rules, and I can see you're already doing it, is to keep yourself muted unless you're the one who is speaking. And also your questions, your comments in the chat box, and then we'll take the questions at the end. And feel free to input your knowledge also in the chat box as we go along, as you see fit in relation to systematic reviews. And yes, please introduce yourself in the chat. I can see you, Doris Njoka from Kenyatta University. Thank you so much for introducing yourself. Introduce yourself, tell us where you're calling in from. And without much ado, we are at 15 now and we have to keep time. So I'll go right ahead and introduce Professor Eleanor Ochodo as we start. So Eleanor is a physician scientist and associate professor in clinical epidemiology, whose research focus currently revolves around evidence-informed healthcare, and research on screening and diagnostic tests. She has been recognized and is a key award winner. 2021, she's an editorial board member and section editor of PLOS ONE Global Health. She has also been recognized by the African Academy of Sciences as one of the top 40 promising young researchers in Africa. In 2020, she was recognized as the academic editor, Cochrane Library of Systematic Reviews. And there is something called Cochrane Infectious Diseases Group. 2020, editorial board member of PLOS ONE. 2020, nominated by the National Research Foundation of South Africa to attend the 12th Hope Meeting with Nobel laureates. In 2019, she was awarded a grant to do her research by UK Institute of Health Research. In 2019, she was also an African Research Leader. She won an African Research Leader Award from the UK Medical Council and Department for International Development, DFID. She's also, 2018, was recognized by the National Research Foundation of South Africa as a promising young researcher. 2016, recognized as a fellow of the African Science Leadership Program. and 2017 co-chair of session at the Global Evidence Summit in Cape Town, South Africa, on methods of systematic reviews. 2016, she won another research grant award from the Wellcome Trust. 2015, won a grant from the World Health Organization, and so many others. And in 2014, she was awarded a PhD from University of Amsterdam in Netherlands. So you can see you're in for a treat. We really have an expert when it comes to systematic reviews. And yeah, I'm excited, very excited to introduce Professor Eleanor Ochodo. Professor Eleanor, feel free to add in anything else that I may have missed in and take it away. Over to you, Professor Eleanor.
Thank you, Marion. Can you hear me?
Yes, I can hear you and I can see you clearly. Thank you.
All right. Thank you for that introduction. That sounds like my LinkedIn profile. So thank you for the detailed description of what I've done. So I will not repeat what Marion has said because it has been quite extensive. Just to let you know that currently I'm a scientist, also affiliated with KEMRI at the Center for Global Health Research, and also with Stellenbosch University. Marion, I can share my screen. I have rights to do so.
Yes, go ahead and share.
Okay. Can you see my screen?
Yes, it's very clear. Thank you, Professor.
All right. Thank you, Marion, again. So the title of today's presentation is The Role of Systematic Reviews in Evidence-Informed Decision-Making. I'm not sure about the interactive method of this platform, but just in the chat, how many have been involved in systematic reviews? Can you just indicate that in the chat?
Okay, somebody can indicate in the chat. The other way is you can raise your hand and you can unmute and share if you have been involved in systematic reviews. Anybody, feel free. Just feel free to respond to Professor.
Okay. It seems.
Yeah. As we are waiting, maybe I can share that, yes, I have been, I attended a webinar not too long ago on systematic reviews and meta-analysis.
All right.
Yeah. Yeah.
That's good to know. So it's only Marion. So I will try and keep the presentation as simple as possible so as not to lose those who have not really had much experience with systematic reviews. All right, by the end of this session outline, a participant should be able to know the principles of evidence-informed decision-making, then understand the importance of evidence synthesis, which is pretty much a summary in healthcare, know the principles of evidence synthesis, understand the role of systematic and rapid reviews in evidence-informed decision-making, and finally, know the general steps of conducting a systematic review. So I will keep this presentation at bird's eye level, not going into the nitty-gritty. For detailed explanations, you can email me, or we can organize for subsequent session where I can go deep into the details of this area. Now, this slide demonstrates the challenge that we have nowadays, both at individual level and then also at with regard to our work and when you're making decisions at all levels of leadership. There's so much information, you do not know which way to go, and sometimes it can get so overwhelming. More often than not, people tend to use ad hoc processes. How do you make a decision? Let's just go by this. And as much as there's a role and room for that, it can be difficult to replicate. And in settings where decisions need to be made constantly, there are always challenges. It usually helps to have a systematic way of handling challenges as they come, not just always having an ad hoc way of dealing with issues. So a standardized and systematic approach is usually helpful in tackling different types of challenges. Now, just highlighting this network to support decision-making, the COVID pandemic really highlighted the need for informational evidence to support decision-making. Initially, there was really no information, but then a time came when there was a flood of information, both scientific and non-scientific. Scientific publications being published, in record time. And then also non-scientific, our WhatsApp platforms were very busy with all forms of evidence and rumors about COVID. So it was quite overwhelming, even at individual level, making a decision was quite overwhelming. So you can imagine now, even for decision makers, when they had to make timely decisions, how will they go about it? When you've got a flood of information, what do you do? And in settings where there's no information at all, what do you do? So thinking through that and having a systematic approach or a framework all the time will really help you tackle different scenarios. Just to highlight a few networks in Africa, these are just examples. There are very many networks now about that are supporting evidence-informed decision-making, but I'll just highlight a few for the sake of time. If I've not mentioned your organization, apologies, but just to know that there are very many organizations, I'm just highlighting a few for the sake of time. We have the Africa Evidence Network that really supports evidence-informed decision-making in Africa through various forms and in different areas, not only limited to health, but other aspects as well, education, etc., and development. We have Cochrane Africa, part of the Cochrane Collaboration. The Cochrane Collaboration is an international organization that advocates and produces research in evidence-based healthcare. So the focus is on health, providing evidence to inform better health decisions. And then there's a Cochrane Africa, affiliate. And then this year, Cochrane Kenya was launched within KEMRI, as a platform within KEMRI and ultimately Kenya for advocating for evidence-informed decision-making in health. And then we also have AFIDEP, the African Institute for Development Policy, that also is a big champion in evidence-informed decision-making in Africa. There are also many, including the center that I'm affiliated in South Africa, the Center for Evidence-Based Healthcare, that produces or basically is mainly involved in training in evidence-informed decision-making with regard to health. Now, there are many organizations that do not really focus on health, but on other aspects as well, as I've mentioned. Now, let's go to definitions and principles just to get us together. What is evidence? So people tend to get confused when you ask them, what is evidence? You'll find that people think they know, but they do not know. So there's a difference between what evidence and what is research evidence. So research evidence is more about evidence that has been generated through research methods. Evidence can be anything, it can be word of mouth, someone's opinion, a report that's not scientifically generated. It can be evidence from anything not really related to research. So it's really important to know the difference between research evidence and evidence from other sources. Then there are two terminologies focusing on, I'm just limiting to health as an example, but you can extrapolate it to other areas. Evidence-based healthcare versus evidence-informed healthcare. It can also be evidence-based decision-making versus evidence-informed decision-making. So they can be used, the terminology can be used interchangeably. Some people use them interchangeably, but there are some subtle differences. And so some people decide just to differentiate because of just the subtleness that comes with these terminologies. So you find an evidence-based decision is an evidence-informed decision, but an evidence-informed decision is not always evidence-based. I know that can be confusing, but that's how in some quarters, it's normally differentiated. So what do I mean by that? Evidence-based. You want to make a decision, you do not know what to do. So you ask a team to give you evidence to support your decision. So a team collates all the evidence, presents it in front of you, and you make a decision based on the evidence that's given to you. Clear cut, you believe you consider all that evidence and you make a decision based on that evidence. However, in some situations, you can request for evidence, consider it, but your recommendation is not really based on the evidence generated. You make a recommendation based on other factors. It's not that you did not consider the evidence. Yes, your decision was informed by the evidence, but not really based on the evidence. And this can happen, for example, where you have very good evidence on the effectiveness of something, but to implement it, you do not have the money, the timing is wrong. So based on that, yes, you consider the evidence, it is strong, but due to other factors, you decide to make a recommendation based on other factors. So yes, you consider the evidence, but your recommendation was not really based on the evidence, but it was informed by the evidence. I know it can be confusing, but though that is subtle differences. In some quarters, people just use the terminology interchangeably, but in some areas, there are those subtle differences, and it's important to know the subtle differences. Now, the use of evidence, I will use WHO as an example. I'm in the health sector, so I'll be biased towards giving examples based on health. So in 2007, there was a big paper that was published about how WHO was coming up with recommendations and guidelines. So this paper demonstrated that decisions were not really evidence-based, but pretty much based on ad hoc processes, expert opinion, or groups of networks that know each other. So based on this, changes were made, and such that you find this is an example of how the WHO now makes recommendations or policies, where first the need for a change is identified. If there's a problem and there's a policy or a guideline that is needed, that area is identified. And then groups are commissioned to provide evidence to inform the policy change. So evidence is got from research studies, from collation or summary of research studies. And then all this evidence is presented before an expert panel, and this panel eventually makes the policies and guidelines that are disseminated to people. So this is just a template of a way of the process of using or making decisions based on evidence, based on the WHO process. But then many other organizations now pretty much follow the same process, not only in health, but also in other areas, in development, in education, etc., etc. Now, the hierarchy of evidence, I always tell people, if you do not take anything out of my presentations on evidence, just know this, because this pretty much forms the basis of the evidence and how to use evidence to inform decision making. We have a terminology known as the hierarchy of evidence, or rather levels of evidence, where evidence is pretty much arranged according to the strength that it generates. So you find this is a pyramid. At the top of the pyramid, you have systematic reviews, which are pretty much a collation of evidence from primary studies. And then below the systematic reviews, you have individual studies, the randomized trials, observational studies like cohort and case control studies, cross-sectional, and then case reports and expert opinion. You see, an expert opinion is at the bottom. Not that you do not want to use expert opinion, but their bias is if you just base your decisions on expert opinions, experts are limited. Experts do not know, are not all knowing. They do not know everything. And usually when you're also consulting experts, more often than not, you tend to consult the networks that you know, people who think like you. So there's always a risk of not having a diverse opinion if you just focus on expert opinion, unless you really, you're very intentional on having a diverse feedback from a diverse set of experts. So once you know the hierarchy of evidence, it will help you understand when people say that we made the evidence that's supporting this recommendation is high quality evidence, high quality based on the strength of evidence that was used to inform the recommendation. And then just to reiterate, expert opinion is not a bad thing. It's just that do not just only base decisions on expert opinion. If there's research to support a decision, it's always also good to consider the current research in addition to the expert opinion. So it's about integrating research to expert opinion to the context in which you want to make the recommendation for. So this is an example of how recommendations are made, where you have strong recommendation, high quality evidence. Once you understand the hierarchy of evidence, you'll understand terminology like high quality evidence and low quality evidence. So why evidence-informed decision making? We need to deal with the information overload. The first slide was about all the information that is available. Now you need to make a decision. I'm currently involved in a task force where we have to collect all this information to make a decision, or to help a team make a decision about a policy locally. So how do you do that? You need a process. And so EIDM helps to deal with the information overload. To keep abreast of the clinical literature, there are methods to keep abreast. It helps to distinguish between useless and vital information. Do not take all research material or any scientific reports at face value. Not everything is conducted rigorously. And the COVID era has also actually uncovered that, where there's been lots of cases about research waste, a lot of poorly done studies being published just because of the rush. And so there's been some evidence that has been categorized as useless and others that is vital. So how do you know what is useless, what is vital? There's a methodology for that. And it's very important to do so, because if you make your decisions based on useless information, you can imagine the implementation will not go well. The impact on health outcomes or education or development outcomes will go wrong. So it's very important to know what is good, what is bad. And then also to adopt beneficial or effective practices, to abandon ineffective or harmful practices. And ultimately, when you think about the health sector, it's to improve healthcare delivery. When it comes to other sectors, to improve education delivery, development delivery, etc., etc. Now, let me move to a terminology referred to as evidence synthesis. You'll get to hear about this a lot in many sectors. It's pretty much, synthesis is pretty much, if I simply said, a summary of evidence, a scientific summary of evidence. So again, I'm reiterating the challenge of information overload. Now, getting information off the internet is like, getting a drink from a fire hydrant. You can imagine how water just comes out from a fire hydrant. All this is a graphic representation of information overload. How do you collect all that information to make a decision? So even if you think about it here in Kenya or where you're situated, there's someone from Nepal, you need to make a decision about your country, and there's evidence from different sectors. In Kenya, we could have studies from the coast, from Western Kenya, from Central Kenya, all these research groups. How do you collect all that evidence to make a decision? Do you just cherry pick based on your net? You have friends in Western Kenya, you know me, so you just call me, give me a paper that from Western Kenya to help me make a decision. Do you call your friend from the coast? Do you call your friend from Central Kenya? And if all your friends give you studies from all areas, how do you bring them all together to make a decision? So there's a scientific process to that. This is old. This was before COVID, where they said there were over 2,000 new articles published in this database each day. Nowadays, there are much more than 2,000 articles. So the half-life for clinical research is 5.5 years. This was, well, it used to say that a paper more than 5 years is old, but COVID has changed that, in that you have a paper about COVID, even 6 months is regarded as old. So the context matters. But in a general sense, a paper that is more than 5 years old is considered old. A systematic review that is more than 5 years old is considered as old evidence. So it's always important to look for evidence that's less than 5 years old to inform decision making. Now again, this is related to health, stethoscopes. The search engine is now essential as the stethoscope. How you search for evidence to inform decision making, you need a scientific process for that. So Definition of evidence synthesis, the process through which two or more research studies are assessed with the objective of summarizing the evidence related to a particular question. And then just giving an example based on the WHO methodology of making recommendations, they start by synthesizing all available evidence about a particular area. And then all the collated or summarized evidence is presented before an expert panel that reviews that evidence and then finally makes a recommendation or a guideline. And then this methodology has been extrapolated to other groups beyond even health. Now, this is again a resource material for WHO evidence synthesis for health policy and systems. So again, why evidence synthesis for those who are not convinced? So we need to summarize a large volume of information to enable decision and policy making. So I know for one particular project I'm involved in, we're looking at, there's a lot of evidence, lots of studies. And then we decided just to now look at the summarized evidence. And even the summarized evidence is a lot. You've got lots of systematic reviews. So now we're looking at lots of systematic reviews. So how do we bring together all this evidence from all these systematic reviews to inform the panel that commissioned us to give them evidence to make their decision? So that's something that you're working on at the moment. So again, evidence synthesis helps to establish whether scientific findings are consistent or can be generalized across different populations and settings. When you bring evidence from different populations or different settings, and even when you're looking at the evidence, you will note the differences. Evidence from North America is different from Asia, from Africa. So you'll be able to tell the differences and also help you make recommendations. And also even locally settings, even in Kenya, for example, findings from Western Kenya could be different from the coast, could be different from Central Kenya. So when you bring everything together, it's a way of even helping you to tell whether there's consistency or whether there's subtle differences, and then also to investigate what informs the differences in findings. And then also about variation, I've talked about that. And then there's the aspect of risk of bias with regard to the quality of the studies that you're incorporating. Remember the hierarchy of evidence. If you're using low quality evidence, that has to, when you're making a recommendation, you have to be transparent about that. Forms of evidence synthesis. Now, there are different forms of evidence synthesis. We have traditional literature reviews, which were published a lot before, still are, but not as popular and rigorous today. So this is pretty much where an expert group is commissioned just to write their thoughts about a particular area. Like Marion, for example, can be commissioned. Why don't you write about the economic implications of COVID in Kenya? So as an expert, you'll be writing from your expertise, and you will, you'll just do a broad search, get a few papers here and there, call your friends, and then write a literature review. So that's not really systematically done, and there's a lot of bias because there's a risk of cherry picking. So based on that, people said it's good to give you a good picture, like an overview. Sometimes when you just want an overview, you can just get a literature review published by an expert. But sometimes when you want to make a decision, you want something that's done scientifically and rigorously and transparently to help you make a good decision. So systematic reviews were introduced where it's a systematic and standardized way of, first, everything has to start with a question. What is your scientific question? People think reviews is just about summarizing evidence, but it's science. It has to start with a question. What is your question? What do you want to answer? That has to be very clear. The question will inform the databases that you search and the extent of the databases that you search, and even the inclusion criteria. What do you really want? If you want evidence about adults only, you will exclude you'll exclude studies about the pediatric population. And then if you want studies about pregnant women, you will also exclude other populations as well. So your question has to be very clear and crisp. So you have another form of evidence. So you have systematic reviews, which is a summary, which is more often than not a narrative summary. Then you have the term meta-analysis. which is now where you pull the findings statistically. You'll find that some of the studies that you look at have got statistical measures, odds ratios, risk ratios. So if you have 5 studies which are giving you estimates, statistical estimates, how do you pull all those estimates together to have one summary estimate to inform a decision? So that is a meta-analysis where you go further and do a meta-analysis. So systematic reviews can contain a meta-analysis, or they may not contain a meta-analysis. So the choice to do a meta-analysis, there are different reasons why you can do or not to do a meta-analysis, but then that's a topic for another session. Now we have rapid reviews and rapid response briefs. This came about a lot during the COVID response, where information was needed yesterday. So before systematic reviews will take 12 months, you're given 12 months, maybe 6 months to give evidence to inform a decision. And this would be, a panel wants to make a guideline, you're given a 6 months notice. But COVID changed that, where decisions were needed yesterday. So how do you collect evidence quickly, a rapid review to inform decision making? So like one project, I've pretty much given a week to summarize evidence to inform a panel. That's quite taxing. So a rapid review is just a systematic review done quickly. So if a systematic review typically takes 6 to 12 months, a rapid review can even be done in 1 week to 4 months. 4 months is I think the maximum that you can define a rapid review. Then you have rapid response briefs. That's also a terminology where you're not really summarizing evidence. It's a way, for example, you find that there are systematic reviews or rapid reviews, and a policy maker just wants a rapid brief. You go to the existing evidence, existing reviews, existing systematic reviews or rapid reviews, and summarize evidence from those reviews through rapid response briefs. We have another terminology known as a scoping review. So this also came about a lot. A scoping review is more like a mapping exercise, where you do not have a specific question, but you just want a general view of what is going on. For example, you may ask, for example, with the universal health coverage, you may just want to know what are the implementation strategies that people are employing for universal health coverage, or what are the implementation strategies for COVID vaccines? What are the implementation strategies for the malaria vaccine? What are people doing? You can see that is a general question. Implementation strategies can be anything. So you just want a mapping exercise to see what is going on, or a mapping exercise to see are there any randomized trials about a particular area? What are the type of studies informing the education, or primary, secondary education? So it's a mapping exercise. So scoping is synonymous with mapping. You just want an overview. And then an umbrella review was another terminology that was introduced, where you have many systematic reviews. So in established areas, like if I'm focusing on health, HIV, malaria, TB, you can find for a particular area, vaccines or something, or a test or treatment. Different groups have systematic reviews, have published systematic reviews. So if you go and find that there are 10 systematic reviews about malaria, TB, or 10 systematic reviews about hypertension, how do you summarize that? So there's a methodology known as umbrella reviews that summarizes evidence from that. Then there are also other forms of evidence synthesis. I'm just focusing on the most common terminologies that you will hear about in settings for decision making. So again, the forms of evidence synthesis, they're non-systematic approaches, which is a traditional literature review, which risks cherry picking, selection bias. Then you have systematic approaches, which are normally recommended because of the focus and the rigor. So these are systematic reviews where you have a clear question and a clear methodology. Systematic reviews are summarized narratively. And then you can go further and do a meta-analysis where you statistically pool estimates to have a summary estimate. So a meta-analysis can be part of a systematic review or may not be part of a systematic reviews. So you'll find in some papers they say systematic review and meta-analysis, while some publications are just labeled as systematic reviews. And then rapid reviews, you will see a lot of this now. These are pretty much systematic reviews performed quickly. I'll explain that again later. Scoping reviews I've mentioned, it's about mapping, getting a broad general picture. And then an umbrella review is a summary of systematic reviews. Now, just the structure and steps of systematic reviews. So again, a systematic review, as I've said, it summarizes the results of previously published and unpublished studies systematically. So the catchphrase is a systematic process, not an ad hoc process, not cherry picking, but a systematic approach. So you have to, there's a methodology of identifying studies, extracting data and summarizing those findings. And systematic reviews constitute the highest level of evidence. So when you want to make a decision, the first thing is ask for, is there an available systematic review? If there's no systematic review, and if it's possible to conduct a systematic review, you can ask a team to conduct a systematic review or a rapid review to inform your decision makings. But always just start by asking, for this particular area, is there an existing systematic review? If there's no existing systematic review, then go to primary studies. So I've mentioned about a meta-analysis, a statistical way of pulling results, and it's an optional component. And there are various ways of deciding whether to do a meta-analysis or not. So this is an example of how meta-analysis looks like. You can see you include all these studies into your review. And then these are the estimates that these studies produce when it comes to odds ratios. So you normally statistically pull them together to come up with a summary estimate. Like for here, the summary estimate is 2.2, and studies have as you can see, they have published different estimates in different areas. So this is just a way of summarizing the estimates from different studies. So again, the general steps of evidence-based practice, you always start with a question. What is your question? What is your first, what is the problem? And then what is the question that you want answered? That has to be crystal clear. Otherwise, if you get the question wrong, people will give you the wrong evidence to inform your question. So you have to be very clear of what you want from the outset. So what is your question? Once the question is clear, you look at the sources. Where will you get evidence to answer that question? So there are various databases, scientific databases, there's real literature, there are websites where you can get reports from. There are all sorts of databases nowadays. There are preprint servers nowadays where you can get evidence from. Once you identify the sources, you find them in a systematic way. Once you get the potentially eligible studies, there's a scientific way of evaluating these studies and then combining the findings or summarizing them, then sharing the findings and applying the findings to inform, applying the findings to a particular setting. So this is the general steps of evidence-based practice. So for systematic review, you always have to start with registration. And this is just a way of discouraging a lot of research waste, because you find that everyone wants, when there's the hype of systematic reviews, everyone wants to do a systematic review. But then why do a systematic review when, if you find that there is another group has registered a similar review, why repeat the same review? Why do the same thing? It's very different. No, from primary studies, you can actually repeat the same question in a different setting. If a study has been done in Uganda, you can justify and say, Kenya is different. Let us repeat the same study in Kenya. But for systematic reviews, it's different, because systematic reviews are a summary of studies. So if a team in Uganda have just recently done a review where they have summarized all evidence from Africa, so as a Kenyan group, why repeat the review and there'll be the risk of summarizing the same primary studies? So you can see the difference between the risk of just doing a systematic review for the sake of. So it's always important to start by registering your review, just to also to limit the risk of unnecessary duplication of work. So the steps of a review, assemble a team with the diverse expertise, because it takes quite a bit of work. Develop a protocol. A protocol helps you to think through the steps before you start working on the actual review. You can never really think of everything, but at least a protocol will help you have an idea of the things that you should think about a priori. So in the protocol, you will formulate your question, develop your search strategy, come up with a way of how are you going to identify studies, how are you going to select the studies, and how are you going to extract studies extract information from the identified studies. So a protocol helps you to think beforehand of the methodology of it before actually doing the review. When it comes to doing the review, again, you have to be clear about the question, develop your search strategy, identify the necessary studies that you include in your review, have a way of selecting your studies based on your inclusion and exclusion criteria, and then have a way of extracting information from the studies, collecting data from the published studies, analyzing the quality. Remember the hierarchy of evidence. Studies have got this. The strengths of evidence vary depending on the type of study you include, and then summarizing the evidence. You can go further and statistically pull the results through a meta-analysis. But remember, a meta-analysis is optional. So there are systematic review stages. This pretty much summarizes the stages. I'll not go through it, but in case I can share my slides for those who are interested. So these are just examples of published systematic reviews in the literature. There are very many nowadays if you just check the literature. Now, rapid reviews, again, it's an accelerated review. Pretty much, if you ask what is the rapid review, it's, in simple terms, it's a systematic review done quickly. So it's a type of knowledge synthesis where the processes of systematic reviews are simplified or omitted to produce information in a short period of time. So what do I mean by simplifying? It can start with the extent of the databases. So for systematic review, if you had planned to search 10 databases, for rapid review, you will say no, because information is needed in 2 days' time. I do not have the luxury of searching 10 databases. I'll only limit to 2 commonly used databases. So I will focus on searching for eligible studies to include in my systematic review from 2 studies. And then even the process of that, you'll have a very specific question, and then you'll also limit the team that's helping you do the rapid review. For example, instead of having people double checking your work, you can have experts doing each part of the review because you trust their experts, and there'll be limited bias. So instead of doing things in duplicate, some reviews can be done singly by an expert, but again, there's also bias with that. But sometimes a rapid review is just to give information quickly to inform a decision. So policymakers require timely results to enable timely decision making. And then time and costs of a systematic review are often a barrier to decision making. A typical systematic review can take time. And usually if you tell a policymaker, I'll give you results in 12 months, you'll not really make them happy. So again, rapid reviews are a form of evidence synthesis in which components of a systematic review are simplified or omitted to produce information in a timely manner. So it's an accelerated process. So again, this is just a resource about rapid reviews. Then rapid reviews for policy making have become very popular, especially in the COVID era. And then these are just some differences between a rapid review and a systematic review with the time frame. A typical rapid review will take less than 5 months. Nowadays, it's even a month, even 2 days, as the example I've given you. And then just the scope of the question. For rapid review, you'll not really go into the details because you need information in a week. You don't have the luxury of just, having a very, complicated question, searching multiple databases, having very many reviewers, or going through rigorous methodology. You want results quickly just to help policymakers come up with a decision. So again, limitations of rapid reviews is they are susceptible to bias, because sometimes if it's just one person doing it, even if it's an expert, the expert could be doing things at night. You're given 2 days, the expert will not sleep. So if you're the one looking at literature at night, there'll be something biased, there'll be selection bias because you're tired. But then as long as you're very transparent about the limitations, that is fine. So just to let you know, in closing, reporting standards for systematic reviews. When you come up with when you're writing a review, there are reporting standards to help you write your review well. So there's a reporting guideline known as the preferred reporting items for systematic reviews and meta-analysis, PRISMA. So they provide a structured format to guide reporting of reviews and minimize selective reporting. Why is this important? Decision makers look to systematic reviews to inform decision making. So if your systematic review is reported poorly, it's going to limit decision making. So this is done because initially people had there's a lot of hype for systematic reviews, but they were reported poorly. Not everything was reported well. So you want to make decisions, but then making decisions on poorly reported reviews is also quite a challenge. So these guidelines were introduced to help authors report the correct things that are necessary to inform decision making. So for any reporting of a review, please always look at PRISMA. Before you work on a review, and then also when you're reporting your findings, use the PRISMA guideline to inform your reporting. And then this is just a network that pulls all reporting guidelines for all forms of studies. Thank you for your attention. I hope I've kept it at bird's eye view and I've not lost anybody. Any questions?
Thank you so much, Professor Eleanor. That was profound. So much learning. Wow. All right. Yeah, it would be nice to get feedback from everyone. Anybody with any questions? I have taken in so much, and I'm like, okay, systematic reviews take time. It sounds like they can be costly. Maybe you could start by elaborating why they become costly as we wait for questions from other people. Everyone feel free to ask any questions.
All right, so they can be costly in that first, the expertise that you need. The expertise that you need to help you. Sometimes for very elaborate reviews, you need a team to help you summarize the evidence. I know there's some projects where you need to summarize 20 evidence from 20, you need to screen 20,000 articles. So it's nice if you have volunteers, but sometimes depending on volunteers can be a challenge. So sometimes you need a team to help you screen through 20,000 articles, and you need to pay them for their time. Accessing the literature, some databases, you need to pay for access. Some databases, you need a subscription. Many countries in many institutions in developed countries have access to databases, but in our setting, in many African institutions do not have access to these databases with all these publications, because you need a subscription, which can be costly for many African institutions. And sometimes you may identify an article, but to access the full text article besides the abstract, when you click on a full text, you're told you need to purchase an article. And sometimes the article can be quite expensive, depending on the journal, from 10 to even some can even be $40. And when $40 is not, it's quite a bit for many people. And especially if you want, for example, if you want 100 articles that you have to purchase and you need to pay all that money, so that can be costly. Accessing the articles, that's if they're not published in open access platforms. So those are just some of the things that can make it costly. The software, if you do not have access to the software for doing the reviews, there's some paid platforms for doing the reviews, and there's some which are free of charge. So like, for example, Ryan is a free platform that helps you do all these processes for systematic review. Then there are other platforms which you need to pay. There's some platforms that say that if you're from an LMIC, low middle income country, they can, waive the fee to use the platform. So even payment to use the platforms can be costly for some people. So so those are some of the things that can make a review quite costly. So sometimes when people are even working on rapid reviews, they tend to use free platforms, and sometimes some people say we're going to just focus on open access articles that have been published open access that we can access, things like that. And then there are also many other aspects that can make it costly. But generally, a systematic review is cheaper than a primary study for the obvious reasons. Going to the field to collect data is different from sitting behind a desk and collecting evidence from behind in your room. Yeah.
Okay, thank you, Professor. And in line with that, you mentioned something to do with Cochrane Kenya. Mm-hmm. Does that mean that we can now access data from, is it like if we Google Cochrane Kenya, are we going to find the platform, and can we get data from it that can help us, especially those who are students in their research?
Okay, so with Cochrane Kenya, not yet. It's recently launched. So not there's still ways of, how do you collect all the evidence to enable access? Because one of the missions is to make evidence accessible. So the core team are working towards making that. So at the moment, I'll say no, because it's still work in progress since it was just recently launched. But then if you go to the Cochrane library, you can access systematic reviews. There's some which are free of charge. I think quite a number are open access. So you can access evidence from the Cochrane library free of charge. Those some, I think, for some you have to pay, but I think for majority, I'm not so sure about the proportion of the free versus paid, but you can get, I know, a huge proportion of systematic reviews free of charge from the Cochrane library. So if you go to cochrane.org, this Cochrane library, if you click on that, you can access the library and systematic reviews for everything. Though Cochrane is more about health. So if you want evidence about development, you'll not really go to the Cochrane library, but there's the Campbell library, which is more of a sister for Cochrane, but that also looks at other aspects besides healthcare. So you can also look at the Campbell library. Okay. Yeah.
All right, thank you very much. And there's a Risi Makoha says, thank you, Professor, for such a great presentation. And she asks the question, when do I need to conduct a systematic research? And then she also asks, can I use the approach for my routine literature search? So the first question is, when do I need to conduct a systematic research, Professor?
Okay, so again, systematic search, it depends on the context. So first of all, it depends on where you're starting from. If you want evidence to inform a decision, you'll look at a systematic review. And then, so if you want, you're part of a team that needs to make a decision on COVID, you will start by looking for a systematic review and summarizing evidence from the existing studies. And then also another aspect is that even if you're from a student, if you want to do a review and you find that in your particular area, there are lots of primary studies, but there's been no review, there's been no attempt to summarize the evidence from all those similar primary studies conducted in different settings, then you can conduct a systematic review. But then it all boils down to your question. What is your main question and how best you want to answer it? If there are many primary studies, you can opt for a systematic review.
All right, thank you very much. Let me read another one. Rada says, thank you very much, Professor, for the insightful and comprehensive presentation. Honorable Vincent Mutsai says, it was a wonderful session. Thank you, Professor. Ahmed Abdi says, thank you so much for this wonderful information for early researchers, especially beginners. Systematic review can be something challenging, and in understanding the structure and procedure, it's helpful. Then they ask kindly, what advice can you provide for those beginners to come along systematic review?
Okay, so for beginners, I think it's first identifying a team that does this work to see how you can be involved, and then also training platforms. Like I think Cochrane, the Cochrane library, for example, if you want to conduct a review, the resources, there's access to, if you need access to literature, if you're going to publish a Cochrane review, the process is free of charge. You have access to methodologists, people who will advise you. The publication is free. If you need a statistician, they can provide you with a statistician. If you need studies or access to data from different databases, there's a team that helps you with that. So the Cochrane Library can be a good start because resources are free of charge, and even publication is free of charge. Plus the Cochrane website also, there's, if you click on the training platform, there are always many training opportunities which are free of charge. So you can even start from that. And even if you do not want to wait for the training opportunities, on YouTube, there's a YouTube, I think, collection focused on systematic reviews for Cochrane. You can start with that just to get an idea of what it's all about, and then ultimately say you want to publish a Cochrane review. So that's where most students start, because there's help and it's free of charge and it's quite rigorous. So that can be a good starting point. Or as I said, you can just attach yourself to somebody who does that work and see how you can link to teams that do that kind of work. I know Camry also began a mentorship initiative last year, where Camry, in collaboration with AFIDEP, the African Institute for Development Policy. So they did a webinar, a one-week training on systematic reviews. And then after that, they asked people if they were interested in a mentorship opportunity. So quite a number of groups signed up. And that was the start of people now conducting reviews and a mentorship of teams of experts in systematic reviews. So they're just completing the first cohort. Depending on how it goes, I think now next year, there'll be a new cohort. So you can look out for those opportunities. So after the training, where there'll be an invitation for the next cohort who want to be trained to do a review. Yeah.
Right. Thank you, Professor. Doris Njoka says, that is amazing, Professor Elena. I have learned many important information about decision making. And I just want to ask, in regard to that, who makes use of systematic reviews then? Who are those decision makers? At what point do I become a decision maker and then I can use the systematic review?
It depends. So a decision maker can be Ministry of Health. At the moment, Ministry of Health are looking towards systematic reviews to inform many guidelines. So if you're a policy maker for Ministry of Health, even in your own area, we are encouraging even departments and groups, if you want to make decisions related to your particular area, you can refer to reviews on your particular area, just to give you an idea of the findings, the gaps, and the way forwards. So even patients, like the Cochrane library now has got a forum for consumers. So mostly like even patients in the developed world, they actually look to the Cochrane library because you want evidence. You want to make a decision about your health, and you want to be informed by the published evidence. So there are plain language summaries that are tailored such that a patient, someone who doesn't have a health background, can understand. So you're finding increasingly even patients are actually also looking towards systematic reviews or summarized evidence from systematic review to give them an idea of, of whether to, take a medication or not. And that was quite evident, with COVID. lots of patients were even now referring to many evidence-informed platforms. Okay, is there systematic, what is the evidence? And they'll look at the evidence summaries or plain language summaries. These are non-technical summaries normally targeted towards patients and other non-technical audiences. So what is the summary? What is the evidence about vitamin C? Does vitamin C really help to prevent COVID? Things like that. So a decision maker can be you as a patient, you're the head of department, a policy maker, Ministry of Health or Ministry of Education, at international level, as a program manager. So even as a student, you have your group, you have your group and you want to make a decision, you can always refer to systematic reviews to help you make decisions. So
okay.
decisions vary. Yeah.
Okay, thank you, Professor. Risi Makoha, would you like to unmute and ask your question? You're free to do that.
All right, thank you for the opportunity. Thank you,
Louder,
Professor,
louder. I think, I don't know if you can, a bit louder. Thank you. Go ahead, Risi.
Yes, so I wanted to ask if maybe you want to collect primary data, like on people's attitude on a subject. For instance, I'm in the health sector, so if I want to collect...
I can't hear you. I don't know if the others, can you hear, Professor?
I can't hear.
Yeah, it's faint, Risi.
All right.
Try again. It's still very faint, very faint. Okay, let me read the question on your behalf. And if you have any other question to add, you can add. Okay, so Risi Makoha is asking, what would you advise someone considering collecting primary data? For example, use of questionnaires to assess people's attitudes on a subject topic for evidence-based synthesis. She's asking, is it feasible?
Okay, because first of all, I think just the definition of evidence synthesis. Evidence synthesis is pretty much a summary of primary studies. So I think that question is more about collection of data, a primary study collecting data from the field. So that is very different. That is not so much of evidence synthesis. But if you have a number of such studies, questionnaires collecting data. So if a team in Western Kenya collects data from health facilities, you mentioned health, the same questionnaire, same question from health facilities in Western Kenya, another group does that in Central Kenya, another team in Uganda does that. So same questionnaire, same question, but different settings. You can summarize the findings of all those individual primary studies through a systematic review. So it's important to know the difference, because the question I think you're asking about is more about collecting data from my primary study. Unless you got
It's what would you advise someone considering collecting primary data for evidence-based synthesis? Is it feasible if a systematic review is missing?
Oh yeah, okay, I see. If there's no systematic review, so your question is that you want to make a decision and there's no systematic review. So again, it's always about the hierarchy of evidence. If there's no systematic review, go down. What is the next best type of study for the question you're asking? So yours is about, I think, perceptions, people's thoughts, which can be cross-sectional. So yes, then you make a decision. You can now collect information from a primary study to inform evidence. So just to be clear, evidence-informed decision-making, you can make decisions from other forms of evidence. You can even base your decisions based on primary studies. But usually what is encouraged is the best available evidence, which is a systematic review. If there's no systematic review available and there's no time to conduct 10 primary studies, you can also base your decisions on one good study that is done. So yes, you can collect data for one primary study and use that to inform decision making. So even for some forums, I've been asked that question. There are no systematic reviews. Can we just conduct a survey to just help us make a decision? So that can help. But then you see that is evidence-informed decision-making based on evidence from a survey, not really based on evidence from a systematic review.
Okay, I think that is helpful. I hope it's clear for you, Risi. And we are asking all the participants if you can fill in the feedback form so that you can receive the recording. Professor will share her slides as she promised. And then if you'd like to join the journal club, you can also get the link on the chat box. Please do that if you're interested. And there's also a handbook from the journal club. Everything is on the chat box. There's a link to the YouTube channel. You can get so much more from there. Yeah. Now, let me see if there's another question. Yeah, and she says, yeah, it's much clearer. So she's very, very grateful about that. I don't see any other question from anyone.
Maria.
I think there's a
Yes.
question from Jessica. There's a hand up from Kay.
Okay. Oh, Jessica, go ahead. Go ahead, Jessica. I hadn't seen that. Thank you very much. You can unmute.
Good evening. Yes, good evening, Professor, and thank you so much for this. My name is Jessica from Uganda. One, I'm appreciating because I hadn't actually heard of the rapid reviews. I'm getting them for the first time, and I've understood how they are. But my question is, if, for example, I have a theory that has been tested over and over again, and their findings
Hello?
Okay, we have lost you.
Yeah.
Jessica, we've lost you.
over it, and it's proving
You're
to
breaking,
be
Jessica.
a form of theory.
Whoa. We can't hear you, Jessica. You're breaking off.
Can or such a theoretical framework so that it can inform decision.
Okay. Jessica, maybe type your question in the chat box because you're breaking off. We've not managed to get a full sentence of what you are saying. I think it's network challenges. Just write your question on the chat box and we'll pick it from there. Meantime, there's Benjamin Akinmoyeje. He's asking, is there a minimum number of a team to conduct the systematic review?
Oh, yeah, I think a minimum is 2. Yeah, usually sometimes some teams, 2 people can do a review. So because once it's done by, so there's really no set standard, but ideally it should actually be 2 people because one person doing a review, that will be a biased review. That's not really, that will be more of a literature review, not a systematic review. So if it's just one person sitting and writing, that is the non-traditional, where you can say that you're using the systematic approaches to systematic methodology to, identify studies, extract data. But if you're just one person, there are always challenges. As I said, you can be working on the review at night. You have not slept. So if you're screening 1,000, if you're screening 1,000 articles, you search the literature, you find that you need to screen 1,000 potentially eligible studies. If you're one person and you're doing it at 11 p.m., out of, those wee hours, you're likely to miss important studies and make, wrong recommendations. So it always helps to do it in a team. Teamwork is always better than doing things individually. Because no matter how good you are, you always find yourself missing important aspects. Yeah,
thank you, Professor. So the minimum is 2. And I want to believe that sometimes, depending on how much of a systematic review you want to do and how many articles are involved, even if you are like 4, each person can take an aspect of it and others another aspect, and then you bring back the report and compile one. Is that possible?
Yeah, more of if you're doing a rapid review, that's when you can do those shortcuts. But a clear review, there's always, if a proper systematic review, it's ideally, even from the discussions, everyone is on board discussing the question, the search strategy. When you're identifying articles, you're identifying them, you know, one team is, so for example, Marion and I, if you're doing the review, we can say that let's search the literature. Let me search independently. Marion will also search independently. So once you have done your selection, we will compare our findings and see if we agree. More often than not, you'll find that I may have missed studies that Marion has captured that they could be important, or vice versa. So it's always good to do things, 2 people doing them independently, then you come together and compare your findings. And then you come up with a consensus based on your discussion or through, you know, discussion with someone senior. So from the process of identifying articles, even extracting information from articles, it's not as easy as it sounds. Sometimes it looks, you can think reading a paper and extracting information is clear. But some papers are so difficult to read. Many papers are not even written well. So sometimes you need a second opinion, someone who will look at it through a different lens to get things that you could have missed, or to interpret things in a different way. So it always helps to work, you know, 2 people working on it independently, then you sit and compare findings. So some teams always have teams of 2. So you, for example, if you've got 20,000, or maybe let's say 2,000 articles to screen, and you're a group of 6, you can divide the 20,000 into, you know, if you're groups of 2, let's say 3,000, that's a nice and easy number. So you can say one set of people will work with 1,000, the next set of people, the next 1,000, the other 1,000. So you screen, so each set is worked on by a set of 2 people working independently who compare the findings. So that's the rigor of a systematic review, to minimize bias.
Wow, okay. So it's quite rigorous is the point. The key thing about systematic reviews. Okay, thank you. Doris says that the link to the feedback is not opening, and David is attending to that. I don't know why it's not opening. Jessica says her network went off, but she was asking if she can do a systematic review to prove an informal or formal theory to inform policy.
I think it did a theory. Again, it's about your question. What is your question? So
she's asking, can I do a systematic review? Let me see. Again, let me go. I don't know. Let me try and go back to her question. Yes, can I do a systematic review to prove an informal or formal theory to inform policy?
Because, you know, every question, scientific, everything in such the question, and each question normally has a hypothesis. So your review, yes, can be used basically, you know, to refute or accept that hypothesis. So I wouldn't say yes, it depends on what you're asking, but yes, you can do that, because some policy makers have got clear questions and have got clear hypotheses. So you can use it because, again, a systematic review is a tool of answering a question through summary of findings. So yes, it can be used to do that, but you have to be very clear about the question and the intent. That will inform the type of review to do, because again, as I mentioned, there are different types of review. I only mentioned the basic ones, but there are more complicated ones, which are really not for this forum at this particular point. Yeah.
Okay, thank you, Professor. Yeah, I hope everybody has got responded to. Yeah, I'm not seeing any other hand up. Let me scan any other question. We are coming to the tail end of this webinar. We still have 15 minutes. If there are any more questions for Professor. Yeah, and we don't want to leave anybody out. So ask your questions if you have them. Yeah, meantime, Professor, I found systematic reviews are very important. Okay, I see a hand. Benjamin Akimoyeje, feel free, unmute.
Okay, so let me help you with my name. Good evening. My name is Benjamin Akimoyeje. Okay, so Professor, thank you very much for your slides. It was really informative. So I see that you are into epidemiology. Now, there's a lot of use of evidence-based terminology, especially in public health in Africa. And we see many of these things failing and not doing what they promise to do. So as someone who is an expert in this area, what do you think when all these public health interventions claim they are designing things for evidence-based and they use all these big words, most of which we found in scientific journals, and we've also seen in academic literature. How do you feel, and how can we address this? Because people use these things to bypass or get approvals for their projects and all of that. So what do you think? It might not be directly to academics, but this is what we see. So what do you think?
Okay, so that's a difficult question to answer because there are different aspects and there are different ways of answering it. But then even just first the term evidence-based, from my discussions, many people begin to use it like cliche. Nowadays saying it's evidence-based can be quite, it sounds strong, but in my experience, sometimes when I ask people, okay, you've said that you're using an evidence-based process, what do you mean? Whenever I ask them what they mean, people will get lost. In many forums, I've asked, okay, evidence, what exactly? And then when they start talking about it, you realize they don't really understand the methodology, but it's a very, you can say, a cool and nice term to use. I used an evidence-based way, but people don't really understand the methodology. So you find many institutions in Kenya are actually teaching the methodology so that people can understand. You just do not use the word evidence-based, because actually in many places people just say evidence-based and they don't really use evidence-based processes. So that's one way. Another way is you can look at it is, for example, the evidence that's used to make the recommendation. Initially, people used to use one type of evidence, but right now there's improvement. Sure, people are looking at different types of evidence. So what do I mean by that? You'll find that evidence-based was based on evidence about an intervention's effectiveness. Okay, this works based on the statistical estimates, but people are not looking at the evidence about qualitative evidence. Yes, this method works very well. Yes, it's good. Yeah, it's very accurate. It can heal. The efficacy is good. But before, people are not thinking about information about acceptability. Yes, this is a good intervention, but is it acceptable to the people? If you implement it, is it acceptable to the health workers who will implement it? Is it acceptable to the patients? Is the system that you want to implement it ready for it? So people are not really considering that type of evidence. It's more about evidence about effectiveness and safety. So aspects about acceptability was not being looked at. Evidence about economics was not really being looked at. So yes, you've got something that has shown to be effective, but you've not looked at the evidence about costs. So yes, you recommend something to be implemented, but you did not think about the cost implications, service delivery implications. So before just be really one-sided evidence-based ways, focusing on the effectiveness, but less on, acceptability. Is it feasible? The service delivery aspects that you have to consider. But now there's improvement, and I'm now involved in some forums where they're actually asking for holistic evidence. Yes, they said we've got evidence that this is very effective, it is safe. But can you give us evidence about service delivery? Because we do not want to recommend something then it doesn't work, because we did not consider the service delivery challenges in our particular setting. So increasingly now, to cater for that, people are now asking for evidence about service delivery, economics, acceptability, aspects about equity. So very important information. And there are also ways you can synthesize that kind of information. If they've got many studies about that, you can synthesize. If there's no study you can even look at, if there's only one study or one qualitative study looking about the acceptability of malaria vaccine, you just use what you have. Evidence-informed decision-making is using the best available evidence. So those are a few thoughts. There are many other thoughts, but I think that one will need another discussion, or a longer time to discuss reasons for interventions not really working, despite them being labeled as evidence-based.
Thank you very much. You answered it very well for me. Thank you.
Okay, glad you're happy, Benjamin. And thank you, Professor. And I've heard you mention qualitative systematic reviews, because I think a lot of systematic reviews have to do with quantitative and statistical and all that. So just to confirm that I had you right, that we can obtain qualitative systematic reviews, they are there?
Yes, they're there. Now they're increasingly there. And this was brought about because the evidence synthesis is more about the quantitative aspects. And people said, look, we need evidence about, does this work? What are people's fears? What are people's perceptions? And so if you find that you have, 5 qualitative studies about people's perceptions in East Africa, for example, you need a scientific way of summarizing that evidence from Kenya, Uganda, Tanzania, in a scientific way to inform decision making. So yes, there are synthesis methods for qualitative studies.
Yeah, that's good to know. Thank you so much. Yeah, there are qualitative methods. Okay, that's good to know. Thank you so much, Professor. There's somebody else asking, is there a set threshold on the number of, let me get to that message. Yeah, is there a set threshold on the number of research documents or publications to be reviewed, to be constituted in the final systematic review? I heard of more than 1,000 per reviewer. That is Stephen Olubuliela who is asking.
Oh yeah, no, there's no set threshold. It depends on the question and the scope. So there's some questions where there's really no evidence, where you'll go and find maybe only 2 studies or 3 studies. But in some established areas like malaria, for example, if you're to do a review on implementation of, malaria, the bed nets or, medication, there's a lot of information. You'll find lots of studies. So it depends on the area. So again, a priority, it always helps to think through that about the scope. If you're going to look at malaria, you're going to look at evidence from malaria, because malaria publications, you can find papers on malaria from 1910, 1920. Do you want to go far back and look at 50,000 articles to inform decision making? So you really need to think about that at the beginning. What is the scope? What scope is feasible? So there's really no set threshold. It just depends on the context and the impact and consequences of the information that you want to generate.
Okay, so there is no minimum set of.
No, it depends on the question. There's some teams that have to screen 50,000 articles. There's some teams that only screen 100 articles. There's some teams that screen only 50 articles. It just depends on the area and the question and the scope.
Okay.
Yeah.
Okay, thank you, Professor Elena. Yeah, we have 5 minutes. Anyone, last minute questions coming up? Comment? Gratitude for Professor. Anything you want to say before we end? Yes, Benjamin Akimoyeje, go ahead.
Thank you. Prof, thank you very much. So I'll take advantage of this opportunity again. I'm a PhD student in isolation, so I don't get opportunity to talk to people often. So here is talking about systematic qualitative research. The challenge I've seen over time is about discussing your findings and categorizing them. Could you just give me, I mean, I've done a few, but can you give best practice on the best way to get something so that people can count on your synthesis like, okay, this guy has done a good job of systematic review? Because sometimes it seems, yes, you use the questions to search, but when you start discussing, you find out other things and you want to veer off into other directions. So what's the best way to discuss your whatever you found apart from tabulating it and all of that and showing what you found in literature?
Okay, I think Benjamin, for that, there always are not there like lots of resource materials, like even for qualitative evidence synthesis, there are papers, just summary papers, first about conducting a qualitative evidence synthesis. There's some about interpreting evidence synthesis. There's some about reporting guidelines. It always helps to know which are the reporting guidelines for qualitative evidence synthesis. So just knowing that reporting guidelines and the resources help so that whenever you're discussing your findings, you discuss them in the context of the recommendations. So most of the reviews always encourage people, so when you're discussing your results, discuss them in the context of, referencing the resources that you use to conduct your work. So if you used a guideline or a recommendation by a group or by the Cochrane group, reference that. So that also lends credibility to your work. And then all these resources have point by point, discussions for this particular area. What do you need to discuss? What is the extent? What are the key things that you're meant to consider when you're discussing this? So I'll really advise you to look to the resources about the area that you want to work on.
Would I be correct if I said I've been using Prisma most of the time?
Yeah, Prisma is for reporting. So, but there's a Prisma general and there's because each review is different, and you find that each particular question has got its considerations. A synthesis of studies about costs has got different considerations from a synthesis about qualitative aspects, from other things. So groups have come up with extensions of Prisma. So you find you have the general Prisma, now you have Prisma for diagnostic tests, there's Prisma for different types of reviews. So it's always good to look at the general Prisma and then always check if there's an extension for the particular area that you want to work on, so that it helps.
Thank you very much. I'll do that. Thank you.
All right. Thank you very much. Yeah. Wow. Because I was going to ask the same question that Benjamin has asked, like, if it's qualitative, then where should we go for the guidelines? But I hear you say we can go to Prisma and look for extensions.
Yes, there's the Equator Network. I think I showed that, I shared that slide. Let's see. Yeah, it collates all reporting guidelines. Let's see. So this is the Equator Network that collates all reporting guidelines. So if you want to do a systematic review, like here, there's the Prisma reporting guideline, then you see their extensions. So the different types, so the different Prisma for different types of studies, types of reviews. So it's always good to look at the extensions to see what is relevant to you. If there's no extension, you can just work with the general Prisma. And then you can see, and for other primary studies, they're reporting guidelines for other types of studies besides systematic reviews. So it always helps to know what are the guidelines and what are the expectations. You can also visit the Cochrane Library Just even Google Cochrane, training materials, Cochrane qualitative, then you'll be directed to the relevant training platforms.
Wow, thank you so much. Thank you so much, Professor Eleanor. We look forward to receiving these slides so that we can, it will be easy for us to go back and look at this, and even for demonstrating how do we go to the Prisma. Thank you very, very much. Today's session has really been informative, and I'm sure it will help us improve our work and our studies as we look forward to becoming systematic reviewers like you. And we appreciate that we have you, because then you can mentor those of us that want to be able to do systematic reviews. Yeah, otherwise, I think we come to the end of this webinar. Today is a weekend. We appreciate that everybody has sacrificed their time to be here. So much more, Professor Elena, we wish you well. And yeah, we look forward to going deeper with you. You can start thinking about what else can you teach us? And I'm sure you're always very welcome. And a lot of people are saying thank you very much. There's Ahmed Abdi, very grateful. Judith, very grateful. Risa Makoha, very grateful for this session. And I'm sure everybody else is saying the same. So yeah, I want to bring this session to an end, unless maybe the last parting shot, Professor, you can have the last word.
No, I think I've said everything. Thank you for the opportunity.
Okay, thank you very, very much. Receive our gratitude. We are so very very grateful. I don't know how to say it better. I know everybody is, the African, the way we say, to say thank you very much. Yeah. And so everybody have a very, very good weekend, and God bless you. And bye-bye.
Bye-bye. Thank you.
Bye.